my name is Amy Sturkey. I am a pediatric physical therapist, and I'm here with Erica, and she's the mother of Ilya. And we're talking today about reflux. So Ilya has this and then some. So reflux in general typically is caused by an immature or poorly developed lower esophageal sphincter. So when you eat food, it goes down a tube called the esophagus and goes to your stomach. And there's a sphincter that closes off that keeps food from coming back out after you eat it. And when that doesn't close well, that's one of the main causes of babies to spit up. That typically, it's not uncommon for that to be poorly developing in typical kids until they get older. So you'll get that spitting up that happens. So reflux is also worsened by lip or tongue ties. Does he have that problem?
He does. So he has a lip tie on his top lip, and he has a tongue tie as well.
It's also worsened by food allergies. Does he have any food allergies?
So he does drink Nutramigen formula instead of the Similac Neosure that he started on because they were worried he did have an intolerance to that specific formula. So we have not seen a decrease in his vomiting with the change, but it was a good step to take to rule it out.
Okay. And it's also caused by a poor latch with breastfeeding or with a bottle. Does he have that trouble as well?
He does. As a matter of fact, we no longer can successfully latch at the breast because of the poor latch that he has, as well as the poor suction that he has. That's the clicking that you hear when he's got his passy or he eats from a bottle.
So that click is one of the signs of a poor latch that you're talking about.
Yeah, it's a sign of a poor latch as well as a tongue tie. Yeah.
So what you see with reflux is that some babies, when they spit up, they don't have any pain. They don't spit up that much, and it goes away.
Yeah.
For some babies, they have pain with that reflux. They throw up a lot, and it causes them to have trouble with weight gain. How is that for Ilya?
So,
does he have pain?
He is definitely uncomfortable when he vomits. It's actually been happening since he was around 2 months old. Okay. We originally had a weight check with his prematurity. We wanted to make sure that he was gaining properly. And at his weight check, it was discussed that he was also sick. And so his doctor sent us over to the hospital because he was showing signs of respiratory distress. But once we got there, it was determined his oxygen saturation was perfect. Okay. And they decided at that time just to do a feeding evaluation. So during the feeding evaluation, they were tweaking ways we were feeding him. They were having us change his routine, having us change the volume, decrease it, do more frequent feeds. And when we left, we had seen weight gain, but that's when we started to see the spit up happen. And at that point, it was just a large volume of spit up. Right. And from there, it gradually increased and went from a small amount of spit up to full projectile vomiting. Massive amounts. Yes, shooting out in large amounts. And it's been like that since he was at that 2-month mark. And so right now, the difficulty we face is we don't know where it comes from. We don't know where the vomiting comes from. We know that he has GERD, and so that contributes to it. Right. But he also has a series of coughing fits during eating. It's almost to the point that he is choking. And so we're currently performing studies or having studies done to rule out things that could be causing it. So, for example, we've seen a cardiologist. A cardiologist has looked at his heart, has determined his heart is perfect. Right. We do intend to see a pulmonologist. The pulmonologist will look at his lungs, make sure everything is going to, look the way it should for his lungs. That's actually an upcoming an appointment that he has. He's also going to be seeing a nutritionist. The nutritionist is for an appointment that we plan to have later on down the road with a pediatric surgeon, because we want to look at having like a G-tube placed or a temporary NG tube placed for feeding because of the issues with the vomiting. And so what we see most commonly with Ilya as far as the vomiting is he will eat. It's not a massive amount. He doesn't, whether he eats half an ounce or 4 ounces, he will cough and cough and cough and cough and cough. And then that's when the projectile vomiting happens.
Right.
So he's had Nexium. He's been prescribed Nexium. He's done a full 30 days of Nexium, and we've actually just had it refilled. And so we're going to continue the Nexium. That we did see a decrease, but it's not gone away. And we've also had some other studies to rule out other issues. So for example, there was a full series upper GI imaging study that was done.
Right.
That ruled out any kind of malrotation that he would have that would cause the vomiting.
Right.
We also had an ultrasound done to rule out pyloric stenosis.
Right.
That also came back clean, so
Right.
no pyloric stenosis. And so from here, it's just a modified barium swallow to see if there's any structural issues that he may be having. I've heard people use the term epiglottis, and my knowledge on that isn't as extensive. So,
Right. All right. As a physical therapist, when I have families that now it sounds like you have a fairly extreme case.
yes,
We talked before, you said that they had told you not to do any tummy time at all because for fears of him throwing up. But now they've modified that, right?
yes. So now that he has, now that he's had some studies done and he's seen a physical therapist for a little bit, or an occupational therapist, they have determined that he can do modified tummy time, the way that you actually have shown me to do it on the knees, the arms.
So what they say is that you want to do tummy time. So tummy time is really important. So it can help with building up the muscles of the neck, building up the muscles of the stomach, building up the obliques, and even the esophageal muscles. So tummy time is really important. It's a last case scenario that you want to say no tummy time whatsoever.
Yes.
But what you do need to do is modify it, like you're saying. You want to make sure it's on an incline, that the head is lower than the hips. So any way that you can do that with a boppy pillow, and it might be that you can do a small incline. For the big projectile vomiters, it needs to be a pretty big incline.
Oh,
so
yes.
It might need to be on you.
Yes.
It might need to be on a ball, on the knees, an incline to help keep the stomach lower than the head. The other thing they talk about is waiting 20 to 30 minutes after eating.
Yes.
To be able to do tummy time. That if you do it sooner than that you're more likely to have the spit ups.
Yes, so that is correct. We actually go as extreme as an hour after because of the extreme vomiting that he experiences. So we usually leave him propped up, completely sitting up for 1 hour after eating. And even during eating, it's the same. So during eating, he does sit up fully. We don't, recline him. He sits, sorry, I'm going to make you so mad maybe. He does sit up completely while feeding, just to help lessen the possibility of the vomiting. But again, it's just it's a hit or miss situation. We do know, his dad and I, and even his brother, we do know if he's going to vomit, just because that coughing, and as you guys have heard during this video, he has had that coughing, and that's pretty mild. It is much worse. I mean, in some cases he will become beet red in the face, and it's almost like he's choking, gasping. He can't get air. It's very extreme. We know when it's going to happen.
Can you? This channel is watched by people all around the world.
Yeah.
And it sounds like from stories you've told me that maybe sometimes doctors have not been necessarily believing of you. Can you speak to them just about how to advocate?
My experience.
Your experience, or how to advocate, or what you wish you'd done, or
So at the time, it was actually a follow-up appointment after his hospitalization because of the the breathing issues that his doctor previous doctor had seen. It was a follow-up appointment. At that follow-up appointment, we had gone in and he had gained weight. It's not that he had lost. He's never lost. But at that appointment, she was like, I'm really disappointed. Like, she wasn't happy about the weight gain, which in my mind, because of every, issue he's faced, in my mind is like, yes, at least there's been some progress. Hearing the I'm disappointed was very upsetting, for sure. And when I left that day,
this is not your first child, right?
No, this is not. This is
not like you don't know how to feed a baby.
Exactly. And so, from that day when I left, I said, that's it. Like, I can't see someone that's going to dismiss my claims. And so I did find a pediatrician who was willing to listen to what I had to say, and I had to be firm. I think that's very important. If you want to advocate for your child, you have to be firm and say, this is what's happening. This is not my first child. I know when there's something wrong. It's easy for a doctor to think, yeah, your child's projectile vomiting. And I've had a doctor look at me and say, really? Projectile vomiting? And I've had to reiterate, yes. As a matter of fact, he had an appointment with his GI, the very first time they were ever meeting. And I told her, I said, he's projectile vomiting. And at that appointment, that's exactly what she did. Really? Not even 5 minutes later, he advocated for himself. And he projectile vomited all over me and all over the office. And it was an immediate change in the way that she was addressing us. It went from a very accusatory demeanor and stance to one of like sympathy. I'm so sorry. This must be terrible. You're a poor baby. You're poor you. Like, we need to do everything we can. So you just need to, you don't want to set up your baby to projectile vomit. But you really need to talk to the doctor. And if your doctor doesn't listen, you are willing to change doctors. Absolutely, yes. Because it's, my kids are my world. And I can't imagine what he goes through every day. And as a matter of fact, his dad was sick last night. And he was like, I didn't feel good. I felt awful. And after he had a vomiting episode this morning, I said, now imagine that every day of your life for months, coughing for months. I said, and these doctors don't understand. And, it's very disturbing because, you see kids that have these issues and they go untreated and worse things happen. And in my mind, it's like, I can't let that happen to my kids. I'm going to do everything it takes. And so being firm, finding someone that will listen to you, like, don't think you sound crazy, because if there's something wrong, you as a parent know if there's something wrong, you would know, because you spend every second of every day with your kids, when they're not acting themselves. And so that's where we are.
I appreciate you sharing your story, because there are going to be people out there who have similar experiences, and they need to know that it's okay to advocate. It's okay to switch doctors. It's, you are the expert on your child, and you have to push what you need, what your needs are, and what your child's needs are.
Exactly.
I am going to, in future videos, show some of the tummy time that would be safe or more safe for a child who is experiencing reflux. I hope this has been helpful for you. I appreciate you so much for being willing to talk.
No problem.
And we'll look forward to seeing you next time. Thanks a lot. Bye-bye.
Thanks.
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.